Next, Child and Family Services CEO Wendy Botelho sits down with VP of Acute Care Services Pam Bolarinho on Community Conversations.
Hi everyone, we're here to talk about our Community Behavioral Health Center at Child and Family Services right here in Plymouth. Specifically, we want to talk about our mobile crisis vans that are coming soon. Pam, can you tell us a little bit about these mobile crisis vans?
Yeah, thank you. So Child and Family, we've been in Plymouth for quite some time as the mobile crisis team. And what that entails is that we have master's levels clinicians and support staff that go out into the community and see individuals that are struggling with mental health or substance abuse. That is, you give us a call and we dispatch within 60 minutes of getting a call of somebody who's struggling. But you also have the option of just walking into our office, which is at 61 Industrial Park here in Plymouth. So part of the mobile crisis is we're seeing individuals that are struggling, and when they're struggling, you could be really vulnerable at that moment. You might be struggling and don't know where to get help. And our team is out there really to just encourage you to get help, making sure people are safe, and really giving them the resources that they need. One of the things that came about this is we started talking about, initially I think it just starts as a joke, what if we had a van that was just out on the road? And then, soon enough I started doing some research and looking into, are there mobile crisis vans out in the community that are doing this work? I found it to be interesting because not a lot of states had this model, but the states that I did find that had this model was, especially in California. So San Francisco started this in 2021. And when I realized the data and what the outcomes were, I was like, okay, I think we can do this in Massachusetts. At which point, I went to you.
That's right. And we're in support of these innovative ideas that allow us to bring crisis services right to the clients in the community, right? Can't say that right away. We were like, yeah, let's do this. How are we going to do this? How are we going to fund it? How's it going to work? But Pam was able to do a lot of research and figure all of those things out, which made it a really easy decision to say, yeah, let's do this. This is going to help the community.
Yeah. So when you think about this, right, so it's kind of just a partnership with what we're already doing. So as a crisis team, we're already out on the road. People go in their own vehicles and they're going out to see individuals. And when I say go see individuals, we're talking through the age spectrum. So as little as 1, 2, 3-year-olds to like 100 plus. So, so we do see everyone of all ages, even though our name is Child and Family, we see everybody. So what we found is that in addition to having our staff going out into the community to provide this service, it would also be nice to be able to have a van that can drive around, and it's very, it's pleasing to the eye, but it also has that piece of privacy, right? So like when you're going to these areas where there's a lot of unhoused individuals and, and they're in these camps that they might not have cars, they might not have money to get on the bus to go, maybe come to our site for some help. But by seeing us every single day out there, maybe one day they'll knock on the door and say, you know what, I'm struggling, I really do need some help.
Pam, can you tell us a little bit about the folks that you do see who are in crisis? What does that look like? How does a person know, whether it's in the van or not? How does a person know that they should contact our agency?
So one of the biggest things is people always think of the word crisis, but they forget we also have the word intervention in our name. So we're a mobile crisis intervention. Our goal is to intervene before you get to a stage that you're in such a crisis that being in the community is unsafe for you. So what we do is we do a complete assessment. It's a master's level clinician that sees the individuals, and based on seeing that individual will assess, determine level, what we call level of care. Is this individual safe to stay in the community? And if they are safe to stay in the community, what can we do to support them to stay in the community, right? Do they need an outpatient psychiatrist? Do they need an outpatient therapist? Do they require a little bit more than that, right? A partial hospitalization? Do they require like a voluntary level of care to the crisis stabilization unit? All of which, without the exception of the PHP, we're able to offer within Child and Family. So our team is literally out there saying, okay, how can I best provide a service to these individuals to keep them safe in the community? But then there are times that we can't keep them in the community. And those times are really difficult. So when someone is completely unsafe, they are suicidal, they cannot maintain safety, at which point we would do an inpatient psychiatric admission. Most of the, we at times can do what we call a direct admit, but in Plymouth with our resources and us really trying to up the resources that are already here, we work really closely with Beth Israel to get individuals to a safe place.
Great. So does a person have to be suicidal in order to get a crisis evaluation?
No, not at all. We prefer that they actually reach out to us before they get to that stage. The goal is to interrupt you getting to the place where you're going to feel suicidal. So part of the van model, right, is you being out there with people least expecting to see this van, and you're in an area that folks are like, okay, what is this van? And then you start chit-chatting with the clinician and the support person in there and asking, like, I had this happen last week. We had some people come up to the van in a different area and say, what is this? And when I start explaining what we're doing, like, we're here to help you. If you're really struggling with mental health and substance abuse, just knock on our door. We'll bring you in. You'll have a private place. It's an office inside the van, and it's completely private. We'll have a private place we could sit with you and talk to you and see what we could do to help. And they were just like, wow, this is awesome. Because you don't necessarily always have the means to get on the bus or to call us because you don't have a phone. And we're trying to eliminate barriers to treatment. And this van really is going to just enhance what we're already doing, but really breaking down those barriers.
Can you tell me a little bit more about what staff will be in the vans? Right, so I heard the staff that are out there doing the crisis intervention. How does that play out in the van?
Yeah, so the van will be equipped with one master's level clinician as well as a support staff. So the support staff could either be a peer specialist, a recovery coach, or a recovery care navigator. Those individuals have, a majority of them have real life experience. So they're able to actually say, like, if it's a peer specialist, to be able to say, like, I too suffer from mental health. I too have gone inpatient in the past. I know what it's like to be in your shoes. Or I too have, relapsed in the past, or I am in recovery, and here's what my recovery journey looked like for me, right? How can I help you get onto that journey? So that second person is so key, because even though they're not the clinician, they're coming with so much experience from real life experience that you hope that the individual they're meeting with can connect with that person and say, you know what? I do want some help from these folks. And this is just, the van is one fraction of what we do at Child and Family in Plymouth, you're right. So we have our open access, which it's real, again, breaking barriers. You want treatment, you don't have a therapist, you don't have a psychiatrist, knock on our door. It's 7 days a week. We have somebody that can meet with you and make a decision at that point. Do you need outpatient therapy? Do you need an urgent psychopharmacy psychiatrist? Do you need groups, right? And so that's in a complement to the mobile crisis piece. And the mobile crisis is those folks that are just a bit to hit that crisis or have hit it. So going to open access might be, they need more than that. So mobile crisis would assist with those kinds of individuals. The nice thing is there's no wrong door. So once a person walks through our door or calls us, we will guide you from there. You don't have to try and figure out, do I need to go to open access or do I need crisis? The team there is, trained well enough to know what avenue somebody should take.
I'd love to hear a little bit about how we will interface with EMS, with police, fire, with the hospital, right? To really do some more diversion from the emergency room.
Yeah. So many folks, I always say this is a joke, but we have the police co-response here in Plymouth. We've been doing it for several years with Chief Flynn's team. It is a really successful. It's 7 days a week, 16 hours a day, and it's a really great program that Plymouth has. The reason I say we joke about this is because nobody realizes that the clinicians that are embedded in the police cruisers are actually child and family mobile crisis clinicians that are in there. But I'm okay with it because it just tells me that the police department in the town has really embraced this model and really know that this model works. So in addition to having a mobile crisis team that's 7 days a week, you also have your police co-response program. And then you have like this van going out there. And in addition to that, we have a really good working relationship with Beth Israel. And we keep them up to date with anything that we're doing in the community, any changes. They're aware of the mobile crisis van that's going out. And they really also not only support us, but they also promote us. The goal is when somebody goes to the emergency room, I always have this saying, it's a 70-30 flip that you want, meaning that in the past, prior to the CBHCs kicking off in 2023, 70% of patients would go to the emergency room for help. And 30% could use us in the community. We're trying to flip it. So what we're trying to say is that 30% that's going to the emergency room, that's the 30% that needs to be there. The 70% that we can manage in the community, we want you to call us. Let us try and keep you out of the emergency room. And for Beth Israel, that is really significant for them because it really allows them to not be so overwhelmed with the crowd that's walking in and wanting to provide really good care to these individuals. But the resources, they might not have those resources. We have it. So let us figure it out in the community so that the folks that are going to the emergency room are there because the resources that the hospital has is the resource they need.
Excellent, thank you. So, Pam, what are you hoping that these vans bring to the community of Plymouth? What do you hope to achieve in the end?
I'm going to go back to the word barriers. My goal is to really break down those barriers for individuals that are struggling. I think people would be surprised to hear that, when we were doing the police co-response program, we wanted to pull data, and it was 75% of the folks that the police were going out to were either suffering from mental health or substance abuse. So that's a huge percentage of calls for service. Our goal is to decrease those calls for service within the police department as well, and the van be that additional support out in the community, and really just being accessible to individuals that are really struggling. And ultimately, you might not say yes to wanting help initially or even the second time or even the third time, but if you build trust with the staff that's out there, at some point you might say, you know what, I am ready. I'm ready to get some help. And really, once you get that help, right, how do we keep you off the streets, right? How do we help you get into a place? How do we help you get into treatment? And really try to give you a pathway of success.
So I'm going to sum up a couple of things that I heard, right, and tell me if I got it right. But what I'm hearing is that there is access to mental health treatment here in Plymouth, right, through the Community Behavioral Health Center. And there's this crisis intervention team that can go to somebody's house, go somewhere in their community, can come to us, right, and now has this really innovative way of bringing a van out into the areas of Plymouth, right, where they can be seen and spotted, and somebody can just walk right in and get services anytime that they see the van or at our location. Did I miss anything?
No, you did not.
All right. And also working really collaboratively with the hospital here, the local Beth Israel team, to really work on hospital diversion. So that way folks are not waiting in the emergency room for long periods of time when they might have opportunities to be able to be met in the community. So changing that narrative, right?
That's exactly what we want to do. We want to change the narrative. We want people to realize it's okay to ask for help. And it's okay to not have to go to the emergency room to get that help. And that if you are feeling suicidal, just because you're feeling suicidal doesn't necessarily mean you need to go to the emergency room either, right? If you're feeling suicidal, calling, the mobile crisis team and saying, like, I'm not in a good space, I'm having all these horrible thoughts, I'm feeling suicidal, let us work with you. Let us figure this out, because there are services out there even for those individuals that are not necessarily inpatient psych admission. So, and folks don't realize that. You think that or maybe your loved one is the one that's struggling with, suicidal thoughts and you don't know what to do. Call us. Let us figure this out, right? Our staff are 24/7. We have a call center that manages all of our catchment area, including Plymouth, and it's 508-996-3154. It is always answered with a master's level clinician 24/7, and there's always a supervisor on site. And I think one of the things that I missed saying earlier is that when the clinician does see an individual, I think it's important to note that they have an idea of what they want to do for a plan, and they work closely with the patient to develop a plan, but there's a whole entire supervisor that has to approve that plan. But we also have psychiatry on call. So if we have to access our psychiatrist, we will. So there is so many of the layers that folks don't realize that we go through when we see somebody. So it's not just seeing somebody making a decision and being done. There are folks that you have to talk to make sure that we're making the right decision.
Thanks for sharing that number with everyone, Pam. All right, so now the last question. When should we expect to see these vans here in Plymouth?
Yeah, so I would say officially for Plymouth, to work out any kinks, because we did kick off in a couple of other cities, is our goal is by January 1st that we will be out there and rolling around in the, in the town of Plymouth and providing the service. It might be sooner than that, but the latest would be January 1st.
And I'll put a plug in that on September 22nd at the waterfront, we're having a ribbon cutting for the van. So if you're interested coming out and seeing it, we'd love to have you out and see the van as we're getting it ready to roll.
Yep.
All right, very good. So Pam, I know that I'm super excited. This has been a project and something that we've talked about for a long time. Extremely proud of the team and our organization for being able to support this and get this out here in the community. Thank you.
I'm excited. It's the first in the state, and I can't wait to see what it's going to do.
Great. Thank you.
Hi, Hi, we're so glad you stopped by. If you'd like to support Community in Action through media, please consider donating to the local scene. The QR code will take you where you need to go. Thanks, friend.